Dr. R. Nagarajan, HOD of Chemical Engineering Department, Dr. Rajgopala Srinivasan, Convener of CHES, Priyansh Kalabhat, Undergraduate Secretary of CHES, P. Megha, Postgraduate Secretary of CHES, and Shashwat, AICHE President. I would like to call upon Dr. R. Nagarajan, the HOD, to give us a brief overview of the Chemical Engineering Department's milestones.
Hello, everyone. I'm very happy to be participating in the inaugural session of ChemPlus 2021. It's been a great event which combines the talents of our undergraduate and our postgraduate students in organizing, as well as all the technical aspects of the festival. One thing that I found to be true is that students are somewhat like racehorses. You have to let them run. You have to give them their head, so to speak, and they'll do a great job. I think it's when we try to micromanage that we sometimes get into difficulties. So I have every confidence that our students, with of course guidance and counseling from our faculty advisors, like Professor Raj Srinivasan, I'm sure have done a fantastic job of putting the event together. It has so many different aspects to it. It combines, what I call rigor and vigor. The rigor is there in terms of the plenary lectures and the more technically oriented sessions and workshops. And the vigor is there in terms of the fun events for the students. There are competitions, there are quizzes, there are panel discussions on career opportunities, for example. Hopefully all of this will add to the fun quotient, which provides a lot of the vigor. And it's also, I think, very good that the Chemical Engineering Student Society has partnered with the local chapter of the American Institute of Chemical Engineers and with industry to put this symposium together. The different energies that these organizations bring certainly adds a whole new flavor to the event, and I'm sure makes it even more useful, not only for the students, but also for the faculty, sponsors, whom we greatly appreciate, by the way, and of course our industry friends as well. This is the third year where we are doing this combined event, and of course the fact that it's going virtual, to me it's in some ways an advantage. It enables us to reach a much wider audience than when we have a physical conference, and I'm hoping that this enlarged reach gives us a greater opportunity to broadcast the message that chemical engineering at IIT Madras is a happening place where we bring together a lot of different energies and synergies, and we want everyone to visit us, see our labs, meet our students, give our students opportunities for internships and placement. And of course, our faculty are always open to collaboration with industry. So again, best wishes and good luck to the organizers of the event. And I wish all the participants a very interesting and exciting 3 days ahead. Thank you.
Next, we have Dr. Rajagopala Srinivasan, the convener, who will be giving us an introduction to the new events, lecture series, the Chemi panel, international speakers, and will also be giving the statistics on participation.
Good morning. As the faculty advisor to the Chemical Engineering Student Society and the ACT Student Chapter here at IIT Madras, it gives me immense pleasure to welcome you to ChemPlus 2021. ChemPlus has always been popular with the chemical engineering student community in South India. This year, the participation is at a much broader pan-India level. We expect several hundred students and scholars to participate in various activities and events. The organizing team has put together a very strong program over these 3 days. Those of you who have participated in previous editions of ChemPlus will notice a few new events. Immediately following This opening, as one of the highlights of the inaugural session, we have a panel discussion on careers in chemical engineering. The panelists are all our alumni, some from the last 2-3 years and others from the last few decades. I'm sure they will provide you interesting perspectives on where your chemical engineering education would take you. Another new feature in ChemPlus 2021 is the set of 5 plenary lectures by eminent people from India and from around the world. Spread out over the 3 days, these lectures will address various contemporary topics from vaccine manufacturing to next generation of process systems engineering, women in STEM, data analytics, and transitioning to a carbon neutral society. I believe you'll enjoy these new events in addition to the workshops, paper presentations, quizzes, debates, etc. that are the hallmarks of every ChemPlus. Although you're not physically here in our beautiful campus, I invite you to participate vigorously online. Once again, welcome to ChemPlus.
Now I would like to have Priyansh Kalabhat brief us about the activities conducted by CHESS this year and his experience as the undergraduate secretary.
Good morning, everyone. As the Secretary of the Chemical Engineering Society of IIT Madras, it gives me immense pleasure to welcome you all on behalf of the entire organizing committee to the inaugural ceremony of ChemPlus 2021. Over the years, Chemical Engineering Society has organized a series of events that capitalize on our strengths and that are built on our commitment to promoting chemical engineering. As an undergraduate secretary, I have had the opportunity to learn and also have fun bringing this fest to you alongside a team of highly motivated and enthusiastic individuals. I believe ChemPlus 2021 would motivate students to reinvent their interests as chemical engineers while also having lots of fun. Let us begin our celebration of the next 3 days, which will be fun-filled and full of fervor. With this, I thank you all and wish you all the very best.
Now we have P. Megha, who will be taking us through this year's CHESS activities and sharing her experience as the postgraduate secretary.
Good morning. It's a great pleasure to welcome you all to the opening of ChemPlus 2021. There's a lot to offer for this 3-day event, and I would like to express my gratitude to the organizing committee for making this possible. Being a master's student myself, ChemPlus has given me and my fellow PG students a platform to participate and take a break from research. I want to take this opportunity to thank esteemed dignitaries, HOD Sir, Professor Rajgopalan Sir, and other guests for sparing the precious time and joining us. I would also like to thank the participants for joining us and sharing their experiences. In closing, I hope all of you will enjoy ChemPlus 2021 to the fullest. I wish we were sans COVID, as the participants could have had a pleasant stay on our campus in Chennai. But still, we have tried our best to make this event as interactive as possible, and we hope it turns out to be a great success. Thank you.
Now I would like to call upon AICHE President Shashwat Jadhav, who will be sharing his views on how AICHE thrives on fostering an interest in chemical engineering.
Thank you for that introduction. As the Students President of AICHE IITM chapter, I'd like to extend warm welcomes to all the participants and attendees of ChemPlus 2021. Since this is the first virtual edition, I'd like to thank you for being a part of the ChemPlus journey. AICHE IITM was established with the vision of promoting chemical engineering as a professional career with multidisciplinary opportunities. ChemPlus has always been indispensable to achieving that vision. Over the past years, we've received a positive feedback from all the student communities and the professors, and we intend to keep the same vigor alive and make it worth your while. With those words, I'd like to end the inauguration ceremony and declare ChemPlus open for action.
Hello, everyone. Very good morning. So welcome to the first event of ChemPlus 2021. Welcome to this event, which is a panel discussion on careers in chemical engineering. I'm Jitin John Verghese, an assistant professor in the Department of Chemical Engineering here at IIT Madras. And with me is...
I'm Saujanya. I'm a chemical engineering sophomore and a student representative of the Chemical Engineering Society.
So together, me and Saujanya, we will be coordinating and moderating this panel discussion. And for this first event of ChemPlus, or the virtual event of ChemPlus 2021, we have a very exciting group of panel members. And as Professor Rajagopalan Srinivasan mentioned, all of the panel members are alumni of IIT Madras. And the panel members are Mr. Abhay Nayak, Dr. Arun Toludur, Mr. G.V. Kaushik, Dr. Prabhakar Ranganathan, Mr. Ravi Khatri, and Dr. Shankar Vishwanathan. So the panelists have association with IIT Madras ranging back, or dating back to the 90s or early 90s to be precise. And some of them have association with IIT Madras as recent as the last couple of years. And they bring with them a wide range of experiences and their careers spanning wide range of domains. So I'm sure we will have an exciting discussion, and we'll all get to have wonderful insights from their experiences, which you as an audience could take back in terms of making choices and decisions in your careers in chemical engineering. So let's get started. So before we start the panel discussion, I would like to invite all of the panelists to give a very brief introduction of yourself. So let me start by asking Mr. Abhay to give an introduction.
Yeah, good morning to everyone who has joined here. My name is Abhay, and I am a graduate of chemical engineering. I graduated in the year 2018. Since then, I've been working with ITC Limited as a manager in the paperboards and specialty papers division of ITC. And I look forward to this panel discussion today.
Thank you, Abhay. Dr. Arun?
Good morning, everyone. Hi, my name is Arun Toludur. I graduated from IIT Madras in 1993. I was in the Saraswati hostel. And after I completed my bachelor's, I came to the US. I got my master's and PhD in chemical engineering at the University of Colorado at Boulder. And after that, I've made a career in biotechnology. I've been in this industry for about 20 years. Currently, I'm working at a company called Arcus Biosciences, where we're working on combination medicines in the fight against cancer. And I'm working on antibody development and manufacturing.
Thank you very much, Dr. Arun. So can we have Mr. Kaushik?
Hi, everyone. I'm Kaushik. I graduated from IIT Madras in 2019 with a dual degree in chemical engineering. I was in the Ganga hostel. Post-graduation, I joined Bain & Company, worked there for about a year. Then I moved to private equity to do investing for about 6 months, and then recently moved back to Bain. So that's like an interesting journey I've had. Look forward to this panel discussion.
Thank you, Kaushik. Dr. Prabhakar, sorry, I'm sorry.
Hi everyone. Prabhakar here. So I was Arun's and Raj's classmate, and I passed out in '93. But I also did my master's a few years later, MS by research in modeling biological kinetics in chemical engineering at IIT Madras. And then after that, I did my PhD at Monash University. Actually, I started my PhD at IIT Madras, then moved over to Australia to complete my PhD. That was in modeling of polymer molecules. And now I lead a research group in computational fluid dynamics and rheology of soft matter, but in the mechanical engineering department. So I teach fluid mechanics to undergrad mech-eng students. But I also introduce PhD students in their first year to what life as a research scientist is. So that's what I do.
Thank you very much, Dr. Prabhakar. Mr. Ravi?
Hi everyone, I'm Ravi. I've graduated in the year 2020. I'm from the Department of Engineering Design. I think I'm the only one who is not a chemical engineer here. And I work as a business analyst at McKinsey and Company. Before joining McKinsey and after my graduation, I worked in an agri-tech startup for 4 months. And I'm from the best and all Ganga hostel.
Thank you very much, Ravi. Dr. Shankar?
Hello, everybody. Good morning. So I date back to the era of the early 90s. So I was in the Chemi batch of 94. So incidentally, I've seen Arun after a very long time. So Arun and I used to be part of the in-state cricket team. And Arun used to bowl a mean in-swinger, is what I remember. So, but after I finished my bachelor's in Chemi in IIT, I did my PhD from Purdue and got to interact very closely with both Raj and Hiran in that time. So we were both in the same lab, actually, working with Professor Venkat. So using AI, machine learning ideas to problems in Chemi. And then right after my PhD, I joined a firm called ZS Associates, and I've continued with that firm for a little over 20 years now. And the common thread throughout my career at ZS has been around using data analytics, sophisticated mathematical modeling methods, and applying it to a range of business problems. And currently I'm based in Bangalore, and I head up the data science team here at ZS.
Thank you very much. Thank you very much to all the panel members for the introduction. So as you can see the audience here, you can see here that we have a wonderful group of panel members bringing in a rich variety of experiences, most of them starting off with a chemical engineering degree and having diversified into the different domains that they lead right now. And you can also see that we also have panel members who are spread across the country as well as across the globe. So this is going to be an exciting discussion. To get started with the discussion, I'll invite Saujanya to kickstart the proceedings with the questions. Saujanya, over to you.
Thank you so much, sir. The very first question we have is a generic question, and we'd like to offer each of the panelists to take turns to answer this question. In your opinion, has there been a paradigm shift over the years with more students opting for careers like consulting, finance, and analytics? If so, what do you believe are the factors that have fueled this shift?
Can go in order, or I can take a stab at this and then pass it on to others as well.
Sure, Dr. Arun, you can go ahead, please.
Yeah.
Thank you.
Okay. So I was just going to suggest that the economy is evolving all the time, right? So if I think back to the to the 90s when I graduated, we had the big .com boom, the IT boom at that time, and almost everybody was going into that field at that time. So I think it's just a sign of the times that there's a lot of activity happening in analytics, the finance aspects. And if I were to hazard a guess as to what the next piece is going to be, I firmly believe, maybe a little bit biased, but I think it's the biocentury we're talking about. I think, by 2050, we would have cured cancer. And, I think there's going to be a lot of exciting things that we as chemical engineers can do in that area.
Thank you very much. How about, yes, please go ahead.
Yeah, so I agree with Arun in the sense that I think engineers of all kinds, right, are typically always going to try out new things. So when you graduate as an engineer, although you learn chemical engineering or mechanical engineering or specific disciplines, you are picking up actually quite generic skills, right? So, and one of the skills that an engineer brings to the table anywhere they go is quantitative analysis, the ability to break down a system into its component parts and analyze interactions between subparts, predict quantitatively, design stuff, and so on. So these kind of very generic skills are useful anywhere, whether it be in hardcore engineering or in business or anywhere else, right? So, and when opportunities present themselves, people will say, hey, I can do that, and they just go and try whatever appears to them. So in that sense, there's been no paradigm shift. We've always been doing what we are doing. It's just that the opportunities, the kind of opportunities that you get, keep changing all the time.
Thank you. Dr. Shankar?
Sure. I guess I have a degree in chemical engineering, but throughout my career, I've been working in analytics and data science, more applied to business, right? So I've definitely seen an evolution in the types of analytics that is being done in the business context, right? So I normally draw a picture, we can't do it here, but if you think about two circles, analytics and business, right? So I would say 15, 20 years back, analytics was a little bit of an outsider, right? Giving information that businesses would use to make informed decisions. But then over the course of the last, I would say 15, 20 years, analytics is not only getting embedded in the business. So you can almost think about the center of business being driven by data analytics. And in fact, it is going to a point where it's business models are getting transformed through data analytics. So that's definitely a evolution that we have seen in terms of what is analytics and what does it mean for business. But I do agree with Prabhakar that the engineering graduates, right, chemical engineering graduates included, really have the core foundational aptitude, potential, as well as the skills, right, applied to potentially a different domain, right? And it's really exciting times for us on that front. So.
Thank you very much. Abhay?
Yeah, I sort of echo what Dr. Arun and Shankar are saying here, in the sense that as the rapid growth in Indian economy is happening, there's also demand for such jobs, right? And when we talk about a paradigm shift, especially in the profiles that Saujanya mentioned, those of consulting, finance, and analytics, it's not like these profiles are mutually exclusive. Companies are actually looking for analytical skills in the people they hire, and then they're trying to apply all of these analytical skills in whatever business sectors that they're working in. Even large consulting firms like the McKinseys or the BCGs or whoever, or even the banks, they have large back offices now with data scientists and data engineers. So it's just that there's a large demand and there's a shortage of supply probably, and therefore you have people paying the big bucks for profiles like analytics, and that's obviously a reason why there's a shift of role towards these kinds of profiles. And I think that's why students are migrating towards such profiles.
Thank you, Abhay. Kaushik?
Yeah, sorry. I think I agree with what Abhay and everybody else is saying. In terms of just the another perspective that I'd like to add is, at least in the short term, right, the 5 years that I spent in college, a lot of the seniors that I looked up to, or people who were close to me, typically chose to take these paths, and we would hear a lot about their jobs, etc., from them. So that inherently gave us more information on a few profiles versus a little less on the others, which probably made us take that decision too. So that's the one additional thing I'd like to add, but others, I think it's already been covered.
Thank you. Ravi?
I would like to add to what Abhay said. So at McKinsey, even though we are a consulting firm, but we also have a lot of implementation experts, and then experts for specific field like auto practice, chemical practice, and so on. And with time, as consulting is now more about implementation than strategy, the number of non-integrative consultants is growing. So even the consulting firms overall will have a lot more for the core engineers as compared to the hardcore consultants.
Okay. So having heard from all of you, one of the things that seems to be as a common theme from all of you is this fact that the competencies that you have from the programs that you have done, which is mostly the quantitative ability or the engineering aptitude to say, is what enables all of you to do what you're doing right now, and not necessarily the very subject specific aspects of whichever is the program. So have you seen any change in the trends from the 90s from your experience versus the recent decades in giving or imparting that specific core engineering or quantitative skills? Is that something that anybody wants to take a look at? Is there any shift in that at all?
Well, no, one big change is, at least at Monash University, is that we don't have workshop anymore.
Okay.
It's all 3D printing.
Okay.
Yeah. One thing that I've seen, of course, back in the 90s, we used to take both courses in Chemie, but also in the final year, we would go and do that OR course by Mama in HSB, right? But at least the sense I'm getting is the folks who are graduating more recently, there's a more active effort to be interdisciplinary, right? Both in core Chemie, but also in allied adjacent areas where there's more quant heavy efforts. Right? It's going to be in operations research, IE, engineering design. So I think that, and in fact, I remember seeing a video by our director saying that 40% of the courses that folks take in a department are from a department are actually outside of. So that interdisciplinary nature of the training that folks are getting, I think, speaks to the fact that people are both having the deep skills as well as the broader skills.
Okay, so this I'll just open this out to Abhay, Ravi, and Kaushik, if you would like to take this. Just to this is a follow-up. So Dr. Shankar mentioned about the interdisciplinarity and the flexibility of the courses that you are able to take in IITM, for example. Does that or that has that helped really in what you're doing today? How do you see that helping in your roles?
Yeah, I think that's very much true. And I just like to add one more point there. It's also the accessibility of online courses and so on, the much better accessibility to those combined with the interdisciplinary nature of or flexibility of students to take up interdisciplinary courses that has helped all of this, come together and move towards that shift.
Thank you so much. Sajanya, back to you.
Yes, sir. So the very next question has probably been debated for years. How does one go about finding one's passion or the job that's best suited for them? Given that job satisfaction and remuneration are always two sides of the same coin, how would you suggest students pit them against each other before making their career choice?
I can certainly take a stab to start it, and then obviously everybody can chime in. For me, my entire career has been filled with serendipity in terms of how things have moved. When I was at IIT Madras, I took one course in biochemical engineering. I absolutely hated it. I was totally into control systems and those types of things. And so I came here to do my master's and PhD in control systems and work with the professor here. And then and then I ended up doing my PhD in modeling, but using neural networks and those types of things, which back in the 90s was just we had to do everything from scratch. There were no libraries or anything like that. So even that happened by serendipity. So one thing I will say is just being open to that and being open to exploration is an important piece. There is a tool that I use that I'm very fond of that I talk about a lot in terms of careers. It's this competency, motivation, and opportunity model. You guys can Google it. You'll probably find something there, and it's really around the three aspects. So competency, see what you're core good at. As engineers, I think Prabhakar and others actually talked about it. That we all have that. And then the motivation goes to the thing about your passion, what makes you happy, what makes you get out of bed early in the morning, to just go do the work you want to do. And so that framework has allowed me over time, as I have evolved as a person because of all the experiences I've had, has really helped me make the different moves, or look at different opportunities in different ways. Turn down some, take the leap on some of those. So I would say, rather than getting too fixated and saying there are two sides of a coin, think of it as kind of a big continuum where you're probably balancing all these things all the time, and you don't have to give one to get the other. I think there are opportunities to have your cake and eat it too.
Thank you so much. We'll follow the same order that we had earlier. Dr. Prabhakar, would you want to take this next?
It's a very hard question to answer in a minute or so. It's a philosophical question, and I don't think there's any one unique answer. How do you find your passion? You must, as Arun said, you must be open to experiment, right? So, and that's one of the big challenges to do when you're just finishing your undergrad, because you find that there are so many people doing so many different things. You worry that if you make the mistake, that something really bad is going to happen, right? And the point is that there are no mistakes, right? So you have to try it. You will fail, but as I did, I tried a few things before. It was almost 10 years before I finally decided that PhD and all that was the way to go for me. And during those times when you're disappointed, you're human. Yeah, you'll be in the dumps. But looking back, I don't regret any of the choices that I made. So but it's also okay if you want to follow the crowd, right? You can't make your decision saying that I'll be the unique guy who doesn't follow the crowd, right? That won't work. If you want to follow the crowd, do the crowd thing, that's perfect. Go ahead, don't do it, don't worry. But if you want to try something else, be ready for a few disappointments, but it's okay. Yeah? It's a philosophical answer. It's not a direct answer to your question. Sorry, but that's the best I can do.
Thank you so much. Dr. Shankar?
Sure, I think Prabhakar and Arun have said it nicely. I would say look for inspiration from both within and beyond it. So I remember when I was in undergrad, there were inspirational professors like Professor Anand, right? So I said, probably maybe I should do become a professor. And so I said, okay, what does it take to become a professor? You have to get a PhD. So that was part of the thing. Then I started doing my PhD, enjoyed some parts of it, didn't enjoy some parts of it. So then I looked around. So what were folks doing with my kind of background that would be more in my sweet spot? Then I said, okay, in my PhD days, I did several courses in operations research and really loved it. And also I got inspired by professors at Purdue. I remember there's a professor called Ron Radin, amazing prof. So I got really intrigued by that subject. And then I looked around and said, what can I be doing in that area? So, but the reason for giving those examples is more look for both inspiration from within, but also look around. I think Kaushik was the one mentioned. You'll hear what your seniors are doing, what your batchmates are looking at. So not that you have to necessarily follow the crowd, but make sure you are informed, aware of what the possibilities are, and the world is open. Right? So.
Thank you. Abhay, you want to go next?
Yeah, as my panelists preceding me have, vastly more experience than me, you would have known by now that it does take some time to really find that sweet spot of, say, job satisfaction or whatever you call it, or even passion, as some might call. But speaking from the perspective of somebody who's, just graduated or worked only a few years, what I feel works for me is, to say okay to whatever comes your way, right? Anything that mildly interests you, you should try out. Any new skill that you pick along the way could tremendously help you sometime later. And one thought that has, stayed with me is that that famous quote that Steve Jobs mentioned in his famous speech of his, that you can only connect the dots looking backwards. So at some point in future, you'd probably say, oh, that particular work I did or that particular skill I picked up 10 years ago has helped me, change the way I look at things. It helped me find my passion and so on. So the underlying message is to keep trying and hit that sweet spot of job satisfaction versus passion at some point of time, and the remuneration will follow automatically.
Thank you. Kaushik?
Yeah, I think most people have covered almost everything, but a few things that I'd like to add, considering that I'm even more junior to Abhay, is that in college, right, you guys have like a lot of time and opportunities to explore a lot of different things. One thing that I tried doing, I mean, now I can say it's all planned, but it happened subconsciously, is that I tried exploring different internships across the 4 or 5 years that I spent in college. I tried doing like work for Shastra, work for Sarang, played cricket, played some other sport. So when you start doing different things, I think it's easier to know what you don't like at all. So when you start eliminating one by one, you at least read something that you're okay with. To find something that you really, really like, I think is the tough part. But when you start eliminating one by one, you finally reach a happy spot. And the other thing that I think all of them mentioned is that what is right for you is right for you, right? Like it's for you to figure out rather than follow somebody else. So I think these two things is something that I tried doing consciously in college, and that has helped me quite a bit.
Thank you very much. Ravi?
I will completely agree with what everyone said. And given that I'm a junior, I'm the most junior here. I would say that I'm still struggling, to be honest, I'm still struggling to find my passion. And I feel that till the age of 30, maybe I have the liberty to go around and explore things and not worry too much about the remuneration part. Because I feel at the end of the day, I might find something which I'm really passionate about. And because of the same reason, I've tried a lot of different things. I've worked in a startup. I even worked in a hospital, given that I'm an engineer. And yeah, I've done research and I'm now in consulting. So I will keep on, I feel I will keep on exploring different sectors, different job profiles, maybe for the next 5-6 years, and then I will make a call on what I'm passionate about.
Thank you very much, everyone. So a couple of common themes that evolve is being open-minded, being open to experimenting. There is no absolute right or wrong, and what's right for you may not be right for everybody else. So test it out, see what works for you, and move on. That seems to be the common message that comes from everyone. Back to you, Saujanya.
Next up, we have a few career-specific questions directed towards the domains that our panel is working in. First up, our question is directed to Ravi. Consultancy is no doubt one of the most sought-after profiles of current generation. For the comprehend those viewing us live today, could you please give us a short overview of what your job entails?
What my job entails? So we predominantly work on two things. First is the proposal work for the companies who want them to be our clients, and second one will be to work for our clients. So second one is the predominant part, and while working for client, we probably predominantly solve business problems for them. And usually the teams are divided into different work streams. Let's say you're working for a manufacturer, then we will have teams like the manufacturing team, the procurement team, then we will have the strategy team, then we'll also have the sales and marketing team. And then we work closely with the employees at the plant or the corporate office, and we try to lay down first of all a plan of action. We spend, let's say, our studies for, let's say, 10 or 11 months. We will spend the first 2-3 months in laying down the strategy, laying down the initiatives of what are we going to work on for the next 9 or 10 months. And then we all go with the client, we all go into the implementation phase where we work alongside them. So 20 years, like 10 years back, the consulting was more about strategy. We used to come, we give them strategy, we give them funds, ye karna hai, wo karna hai. But nowadays, it totally depends on the implementation part also, where we have to deliver what we have promised to them in the strategy phase. And consulting overall is interesting because we get to work in different sectors. So let's say for 3 months I'm working in automotive. For the next 3 months I can work in agri, or I can even work for a new age tech startup. But at the same side, we also have downsides of it. We might have long working hours on some specific days. We have to travel a lot. Like right now, I'm in Jaipur. My hometown is Delhi. I try to travel. I tend to travel every weekend to home, and it's a little tough. Otherwise, I think for someone who is passionate about meeting new people, making connections, and who's still trying to explore different sectors and different industries, consulting is the best place to be at. I think Kaushik can add more to this question.
Before we go there, just a quick follow-up on this. So you said one of the exciting aspects about consulting is this opportunity to look at different sectors. But how do you deal with the fact that, I mean, you probably don't bring in the domain experience, and how do you switch within very short periods of time?
So for the first 2-3 years till the time I'm an associate, I have the liberty to explore different areas. Let's say I did a 6-month study in one sector, then I can ask my manager to put me in another sector. But after 2-3 years, the firm will expect me to build some expertise in 1 or 2 specific domains. So I'll have to build expertise in one primary domain, and I can have one expertise in one secondary domain. So if I want to climb the ladder, I will have to bring that angle to my profile. But as an associate, I have the liberty for the first 2-3 years to explore whichever sector I want to.
Okay, thank you.
Yes.
Back to you, Sajanya.
Thank you, Ravi. Our next question is directed to Kaushik. How has your perspective of careers in chemical engineering changed since your graduation? Could you also please elaborate on what your current job entails?
Yeah, sure. So I think the first thing, when I just graduated of college, joined Bain, a completely different job from what I'd learned in my 5 years at IITM. I thought that's the end of chemical engineering. I wouldn't really use anything that I'd learned, but I think that was a misnomer. And then I realized that a lot of subtle things that I picked up in class, especially on the quant side, were very, very useful at my work, and it would help me a great deal when I could just draw parallels between what I'm trying to do right now and what I've done in class. That's one. And the second thing I think is slightly, I mean, it's not chemical engineering related probably, but career related that I've picked up over the last 2 years is a lot of us tend to look at the really big things and then say, okay, this is what I want, etc. But whenever at least for me, when I've tried to do that, I've not been able to really find out if that big thing is correct for me or not. So I would rather look at the really smaller things that make up the big chunk and then try to optimize for them. That would give me short-term job satisfaction, etc., which would eventually build up in the long term is what I feel. Again, on your question on what my job entails, it's almost very similar to Ravi's job. We do a lot of, I've been in the consulting domain for the last 1.5 years, worked across a couple of sectors, work with the management teams of different companies, help them with their strategy, drive some implementation work, etc. So yeah, that's about it, I guess.
Thank you so much, Kaushik. Next question is directed to Dr. Prabhakar. How may one recognize one's interest in pursuing a PhD? What is the future scope for exploration in research and academia for chemical engineers?
Okay, the first thing I'd like to say about doing a PhD is that don't do it if you think that PhD is the highest qualification you get. There's a lot of, at least in my days, there's used to be a lot of social, people used to think, oh, you're a PhD, you must be God or something like that. Please don't do a PhD for those reasons, right? A very simple way to look at PhD is that it is a professional license to be a scientific researcher. That's it. Okay. And during a PhD, you have to think of it as an apprenticeship in becoming a scientific researcher. Yeah. So the question you have to really ask is, do I want to go and be a scientist? Yeah. So what do you need what do you need to identify in yourself? I think I think there are two things that this is a very personal opinion. It will change from person to person. Okay, there are two things I think that are important. One is you must be interested in solving problems. Okay, it's not an interest in chemical engineering, interest in mechanical engineering, or anything like that. It's an inherent interest. You must have fun solving problems, right? So when I remember when we were in Saras together, right, with Arun, right, we would all do all kinds of things, and we would, like everyone does before the exam, we would try to solve all the problems, right? But we would have fun doing it, right? We would all sit together, spend the whole night, and then kind of compete against each other and crack problems, right? Cracking problems and getting excited by it is fundamental to being a researcher. If you enjoy that, this is very important, right? If you enjoy being that, then you have the first ingredient to be a scientific scientist, right? The second thing that you absolutely need, right, is to be driven by curiosity. Yeah, scientists are like everybody else. They are driven by greed, right? They are driven by money, fame, everything else, right? But in addition, the other thing that's a key component is curiosity, right? You must be interested in getting new knowledge for society and then trying to see how that new knowledge can help society. Yeah. So if you're that inherently curious person about the world, wants to find stuff, wants to learn stuff, and you enjoy solving problems, you have the right ingredients, right? But if I look at those ingredients, with those ingredients, you can do anything else, right? You can be in business, you can do whatever everybody else is doing. So those interests, those skills are not necessarily only for a PhD pathway. Okay. Let us say you have your you've decided you want to be a researcher, right? You've done your PhD. What after that? Does PhD mean just becoming a professor? That used to be the case maybe 20, 30 years ago. Even in my time, it was never the case. But these days, right, once you get a PhD, like our panelist members, Arun, everybody here, right? So if you, once you do your PhD, there are lots and lots of other opportunities, probably more exciting opportunities than becoming a professor, right? If you do decide to be a professor and you're interested in academics and teaching and so on, very importantly, yeah, don't make the mistake of assuming that a professor's life is nice and they get 3 months holidays and they just come in for a few hours and teach and then go home and relax. Yeah. If you're on a career track as a professor, life is as busy as any other career, right? If you're after a career, you want to be successful in something, you just have to work it out, right? Exactly the same being a professor. Yeah? So if you're prepared for hard work and you're curious and you have interest in problem solving, you have all the ingredients to pursue a research career.
Thank you so much, sir. That was really very intriguing. Next question is for Dr. Arun. How closely are the streams of chemical engineering and biosciences or biotechnology intertwined? In the future, how do you believe biotechnology and chemical engineering shall support each other and bolster groundbreaking development of drugs and medicines?
Yeah, that's a very good question. I think in terms of biotechnology is a pretty big field, and maybe I'll just concentrate in one small area and give a couple of examples. So if you think of biotechnology, we're making medicines using cells that have been modified to express certain proteins, for example. And so these are made, these cells are grown in bioreactors, and then they make, in addition to the protein that they're trying to, that we need, they're also making a whole bunch of other things, and you have to have a whole series of purification to make the product that then ultimately, hopefully, makes a difference in patient's life at the end of the day. So something like that, if you think of cells, the cells fundamentally, you can think of them, an individual cell as a chemical reactor. What it is doing is there's a whole bunch of reactions that are happening. There's mass transfer happening. There is fluid dynamics that are happening. So and chemical reactions are happening. So I think chemical engineers have an opportunity at the fundamental cellular level, along with the environment, to model those types of things. So, and there's been a lot of progress in that in the recent couple of decades in those types of modeling. So that's an example of what's already happened. If I look to the future, an area similar in the same type of frame of reference is when we in chemical engineering we learned about batch reactors, continuous stirred tank reactors, CSTRs, and things like that. Interestingly, our biotechnology industry making the large molecules is still predominantly batch culture today, even today. And I think the next forefront of revolution, and it's actually happening at rapid pace right now, is the intensification of the processes and the ability to, instead of using a 20,000 liter reactor, to use a 100 or 200 liter reactor and make the same amount of product in something that takes 200,000 square feet, make that in 2,000 square feet, for example. So process intensification, this is again a place where chemical engineers play a perfect role. You will be able to bring our knowledge and fundamentals of connecting processes in an integrated way. And that is important because by doing that, we'll actually be able to make medicines cheaper. And that has a very practical impact. We'll be able to get these expensive medicines that are very difficult to make, very expensive today because the processes are inefficient. It has a practical impact on society where we can get these life-saving medicines all over the world. So I think that's the place where I expect it's already happening and will only continue to accelerate.
Thank you so much for enlightening us, sir. Next question is directed to Dr. Shankar. With the gradual integration of high-performance computation, intensive mathematical modeling, and data analytics with chemical engineering, how integral have these domains become in revolutionizing the job market in chemical engineering?
Thanks, Virginia. So no, absolutely. I think the forces that you mentioned, right? Like, so availability of like larger data and structured data, right? The increase in computation, right? And the ability to, some of the algorithms methods, Arun referred to neural networks. We were playing around with it during our PhD days, but there were limitations on the computation, what we could do. But now those methods, techniques are becoming more increasingly viable, practical to apply across a range of problems. So definitely the confluence of these, right? Increasing volumes of different types of data, really the speed and increase in computation, and making it viable to use some of these advanced mathematical models. I think it's definitely happening in spades now. Of course, there's also coolness and a buzz factor to it. People talk about deep learning and reinforcement learning, and there are some limitations for what you can do with it, and there are some areas where there's more encouraging signs and promise. So you need to have the ability to distinguish where it is cool and buzzy and where it is actually relevant, practical, and where you can make it work. So so that's going to be critical. That's where the human factor comes in for sure. And in terms of its relation to chemical engineering graduates, I would say in some sense, back in the day also, I remember Professor Raghu, he was doing his PhD with Professor Venkat, and using advanced mathematical models for neural networks for doing fault diagnosis problems. I would say Chemi folks in some sense have a little bit of a lead, right? Like already the problems we were solving, we were using sensor data, right? Manufacturing sensor data, analyzing it with advanced math models. Computation, of course, is catching up. So that's, but I think the training that we're getting in Chemi is very much relevant for us in this day and age. And if I would say some of the stuff that we do in Chemi gives us a bit of a edge in advance. So you can think about replacing maybe manufacturing sensors with sensors in the real world and the business world, right? Like your Fitbit and your watches are tracking what you're doing on a much more continuous basis. But you can essentially think about instead of a system of reactors and sensors, connect sensors, you can think about business sensors in the real world and how do you analyze and make sense of it. So I think the skills we're becoming in chemi are translatable and equally relevant in a broader set of contexts also.
Thank you so much for the extremely pertinent answer, sir. Our final question is for Abhay. What exactly does your job in the FMCG, that is the fast-moving consumer goods sector, entail? According to you, what are the kinds of innovation the future holds for this sector?
Yeah, thanks, Saujanya. This is one of the questions I get on a regular basis from juniors and people from the outside, right? So how I look at it is that the FMCG is a really vast space. It covers the end-to-end supply chain of any product you're talking about. So one could be working anywhere from the sourcing of raw materials to the manufacturing, to the logistics, the supply demand planning, or even the sales and marketing. So my experience could be, vastly different from the next person you talk to. But if I have to give some context, in the 3 years that I've been in the FMCG space, I've worked in areas that are ranging from, say, carbon neutrality, sustainability, waste disposal, to setting up quality management systems for our chemical vendors, improving farm productivity of one of our, agricultural based raw materials, and all the way to using big data and analytics in productivity improvement, using control systems data to improve efficiencies in the manufacturing process. So what FMCG offers you is the experience of working across the value chain, and not just understanding the technical aspects of these, but it really gives you a broad business view of how, various things link in a business, and how external market factors and internal constraints affect your overall business. So I think, generally speaking, FMCG will give you a very vast set of opportunities, and it really depends on which company you're working for and your own experiences. As far as innovation in this sector goes, I think Dr. Shankar has touched upon this. One of the things that I feel will really blow up is the usage of smart sensors, right? The increased adoption of IoT based sensors, things like VR and AR, and its adoption in manufacturing. Companies are increasingly seeing the benefits of increased visibility of data and its value chain and its power in decision making. So this penetration of what people call the industry 4.0, or the fourth industrial revolution, where data is being used to improve efficiencies across the value chain, is something that this sector is slowly adopting. It has lagged behind, say, sectors like banking and retail over the past few years, but it's quickly adopting. And I think this particular adoption of big data in manufacturing is going to produce a lot of value to all stakeholders involved. Yeah.
Thank you so much. With such a wonderful panel, it's quite possible that it can go on and on for hours with more questions and discussion. But unfortunately, we are short of time, and we have another program that we need to start right away. So I would like to say that we should be closing this session soon. So let me take an opportunity to thank all the panel members for taking time to be here with us and sharing your thoughts and experiences on a wide range of topics that we have had a discussion on today. And on behalf of the Department of Chemical Engineering and the Chemical Engineering Society, I would like to thank all of you for participating in this event. And just a couple of other notes of thanks to the convener of CHESS, Professor Rajagopalan Srinivasan, who's been behind all of the activities of this entire program for the next 3 days. And none of this goes without the support of the head of the department, Professor Nagarajan, and the entire team of the Department of Chemical Engineering. So big thanks to all of them. Obviously, this event will not happen without the student volunteers who've been putting in a lot of effort behind this event. Especially for this event, I would like to thank Saujanya, who's been the mastermind and who's been coordinating all of this for the last few weeks, I guess. So great job. Thanks to Saujanya. And thank you to the audience. I hope all of you enjoyed this session, and hope you have got a good perspective on how to go about making decisions. One thing that you would have realized is there's no right or wrong decision. Be open-minded. And another thing that you would have realized is chemical engineering is probably one of the best places to be in and the most versatile degrees to have. And as Professor Nagarajan always says, the Department of Chemical Engineering at IIT Madras is one of the coolest. So you're at the right place at the right times, exciting times ahead. All the best to all of you. Thank you very much. So that's it. Thank you so much.
Thank you.
Thank you very much. Thank you.
Bye-bye.
Take care.
Yeah.
All the
See you all, everyone.
Bye-bye.
Yes, sir. We'll be starting with a plenary lecture right now. Am I audible, sir?
Yes, you are.
Thank you, sir. So this is recording live. I am P. Megha, PG Secretary of Chemical Engineering Society, IIT Madras, and it gives us a great pleasure to introduce you to our first plenary lecture for ChemPlus 2021. We have the lecture by Dr. Satyanarayana Subramaniam, the Head of Quality Control Biologics Division at Dr. Reddy's laboratory. Dr. Satyanarayana managed the DRL's molecular biology and analytical development functions. He had also worked in Biocon as head quality control for biologicals and insulin. Dr. Satyanarayana returned to DRL as head QC to lead the functional teams for the launch of for their several anti-cancer recombinant molecules like GCSF, PEG-GCSF, and rituximab. Sir shall be delivering on biologicals and vaccines in today's lecture. The audience is welcome to post questions on our live YouTube channel, and they'll be conveyed to Sir after the lecture. Sir, we can start the session whenever you're ready.
Thank you. Thank you very much. And thank you for the invitation. It's a pleasure to talk to people, students. The only problem I have here is that I can't see anybody, and it becomes very difficult when you're trying to give a lecture. I'm used to talking to students. I do a lot of lectures at BITS Pilani, Hyderabad. I'm regular faculty, visiting faculty, or however you want to put it. So I enjoy teaching. So this is an extension. I'll give you a reason why I want to specifically talk to IIT Madras. So you may or may not know, but one of the heads of Dr. Reddy's Biologics for a long, long time was Karthikeya Reddy, an ex-IIT Madras graduate. He finished his chemical engineering from IIT Madras, went on to the US, where I actually overlapped with him during my PhD program. He was doing his PhD in chemical cell biology. I was doing it in microbiology. And he and I had a lot of arguments about scientists and engineers. So we always had this question as I used to, since I was from the sciences, I felt like scientists have a role, and he was an engineer. And he says, no, Satyam, engineers are more important. So this argument went on for a long time. But today, what I want to do, since I'm talking to a bunch of engineers, I better, tell them that they are on equal footing as scientists. But I basically wanted to make sure that we get a feel of why scientists and engineers have to work together. We talk different languages, we have different things, but the problems we're trying to solve is one single problem. So my presentation today, I'll just switch over to share my screen so that you guys can actually see the presentation and not my face, which is going to be better than my face. It's going to be about how science and engineering come together to solve problems. And I'll tell you what the real problem in the biotech space is. So I'm going to be very generic. I know I have about 40 minutes of presentation. I'll try to skip through slides very quickly. None of this is like information heavy, but it is basic concepts that I want to get across and where science and engineering come together in biotech. Okay. So let me share my presentation. This I hope you guys can see my presentation.
Yes, sir.
Great. So let me tell you how the flow of the talk is going. I'm going to define a problem statement. Then I'm going to tell you where scientists and engineers work together to solve the problem. I'll give a little, if I have time, I might go on a general challenges that I see for the future generation and a long-term view of the field. I'm not sure I'll have enough time to do that, but those are only a couple of slides anyway. So very, very quick recap of recombinant DNA. Basically, what we do is we take a cell which has DNA transformed into it in any particular way. Doesn't matter how it is, and doesn't matter which cell line it is. We get a pool of cells. We isolate cells which are the appropriate one. We bank it. We then also do a couple of rounds of dilutions to make sure that we have a single specific clone. Okay, this becomes very critical in an industrial setting. And all my talk is going to be about industrial biotechnology specifically. So we need to have a very clean single type of cell so that we don't have mixed populations of cells. And that we spend actually a significant amount of time trying to get this part done. And then we have what is called the final cell bank, which is a master cell bank. We do a lot of testing on stability, etc. That's not critical, but that's critical from an industrial perspective, but not from the stocks perspective. So we now have a bank of cells which are producing a product of it. So that's recombinant DNA in its entirety. All that you learn is can be summarized in this one single slide. So let's define the problem. So what's the actual problem that we are seeing? So this is the structure of, as you just mentioned, GCSF is one of the products we produce, and I just picked it up because it's the easiest structure to get in the net. This is the structure, the X-ray structure of GCSF. And if you look at the X-ray structure, it's very well defined. It's a single specific structure with all atoms, placed in three-dimensional space. If you take a look at the NMR structure of the same molecule, this is actually a mixture of 10 different structures of GCSF that NMR picks up. And these are 10 structures which are the most common structures. It doesn't mean that it's only these 10 structures that exist. If you take a look at this one, this is the N-terminal part of the molecule, and you will see that the same N-terminus can exist here or it can exist here. And this is one of those undefined secondary structures. And you can see again, there is a lot of variability in the structure available. This, we are talking of a protein which has about 175 amino acids approximately. But just imagine, here is aspirin, which is very well defined. So an aspirin made in Dr. Reddy's versus an aspirin made in or any company in the US is going to be exactly this structure. It's a very well-defined structure. There's going to be a little bit of flexibility, don't deny that. But for all practical purposes, it's a very well-defined structure. This is, say, somatotropin, very similar to GCSF in size. And you will see that it's got some complexity, as I showed here in the GCSF. Now, imagine an antibody, an entire order of magnitude bigger. It's about 1,400 amino acids, 25,000 atoms. So you can imagine the complexity of the structure that exists in this particular one, right? So, and I quickly want to just talk, because I was also asked to talk about vaccines, and I want to just tell you that from my perspective, from a biotechnologist perspective, vaccines are really not that different. We have today's famous SARS-CoV virus, basically a capsid with certain structural proteins. Then you have the spike protein, which interacts with the receptor. If you take a look at this one and you take the spike protein, its structure is very similar in the sense that it's a complex protein. So therefore, it has a fairly rigorous structure that's already been defined. And 1 second, excuse me, I'll dial back in a second. Give me 1 second, please.
Yes, sir.
Can you see me now?
Yes, sir.
Yes, sir. Good. So here is the spike protein, and you will notice that the spike protein also has a defined structure. Now, if you take the vaccine part of it and you say how are vaccines made, there are the traditional viral-based vaccines, which is the total viral-based vaccine, I don't want to deal with that. There is a nucleic acid rich, the now famous nucleic acid based vaccines, which is the mRNA based one that BioNTech has. We'll ignore that for a second. But if you take these two parts, right, where there's a recombinant product being produced, it's either the what Reddy is planning to sell, which is the Sputnik V, or if you take something like the Bharat Biotech, not Bharat Biotech, but the Pfizer one, which is the protein-based, the spike protein-based, AstraZeneca's spike protein-based. These ones are recombinant in the sense that they are producing a protein. So they have the same complexity that a standard biotech product has. So where is this the variability arising from? Where I want you to focus on is this is the structure, the cartoon structure of an antibody. And if you take a look at this structure, you will see that there is N-terminus, there are the C-terminal parts of the peptide, protein. And if you take a look at the types of variability that you see, if you have a glutamine or glutamic acid at the N-terminus, there could cyclize, and that's a chemically driven cyclization. Then you have deamidation that's happening. If you have an asparagine next to a glycine, there is a chance that it will actually deaminate so that you get an aspartic acid. So in this case, what you're having is you actually shifting it to the acidic side of the property of the molecule. You have isomerization, racemization, succinamide formation. And if you have, since these proteins are produced in a culture, you end up sometimes with the sugars that are present for the cell's culture. They actually tend to get covalently linked to the protein. This is called glycation. It depends on the particular type of sugar that gets added on. And this is different from the actual glycan, which I'll talk about in the next slide. And you have C-terminal proamidation, you have a C-terminal clipping. If you have a lysine or an arginine, you can remove the C-terminus. So these things happen. So the types of changes that you end up with is in an antibody, and this is also the same that happens in spike protein. So I'm not going to talk about vaccines per se here, but we'll just touch upon occasionally. Is that you have N-terminal heterogeneity, you have modifications of amino acids. Sometimes you get fragmentation because some of these hinge regions are very susceptible to proteases and peptidases. So you end up with these fragmentations. You have disulfide linkages that don't always form. They can form alternate disulfide linkages. And you have C-terminal heterogeneity. But the biggest concern area that most companies in India and around the world which are working on biotech products is about this particular glycosylation, which I'll talk about in the next slide. What they have is, if you take erythropoietin as an example of a protein, this is the number of different types of glycans it can have. A single erythropoietin protein has 3 glycans, right? Those 3 glycans can be represented by any one of these. And in a population, you have different types of glycans that are present. So you end up with 14 different isomers for erythropoietin. And if you take the next generation of erythropoietin is darbepoietin, you have 22 different glycans, sugars that are decorated on top of it, right? So you end up with a huge population which has different sugars on it. Same thing, this is actually the type of glycans that are present on the spike protein. I brought this up just because in today's day and age, everybody wants to talk about the spike protein of CO2. So you will see that here is the number of these blue balls are representing the different glycans that are present. This is the reason that some vaccines work better than others, because the decoration that you have of the glycan depends on the way you grow up the cells, that are expressing the spike protein, and the way the cells actually produce the glycan as part of the post-translational modification. So these things is a very significant difference from batch to batch. So what is the actual problem? The problem is you have a potential candidate. You need to convert that into a drug. You need to convert it into a drug that is commercially viable, because if it's not commercially viable, no company in the world does this as a charity, which means it has to be something that is easily controllable, easily produced at a level which is commercially viable. And you need to do this from batch to batch to batch, because from a regulatory view, consistency is the key. Okay, if you're not consistent in your process, no regulatory body will ever give you an approval. So we need to do this. And we need to assure that this characteristics that exist in drugs exist for a long time, which means that if I manufacture the drug today and the patient buys the drug 6 months, a year, or year and a half from today, the properties should not deteriorate to the point where we cannot accept the drug which is sitting on the shelf. So stability of these characteristics becomes critical. Okay? So that is so in a nutshell, this is the problem both scientists and engineers have to tackle. Okay, and how do you do this? And which ones do scientists do well and which ones do engineers do well? I'll talk about in the next few slides. So when you take any biotech company, this is the general organogram that I want to present. I know there are a lot of functions missing, and if I show this presentation to any of my colleagues here, they will kill me because I'm not putting a lot of other functions. But from this audience perspective, we have cell line development, which is purely a molecular biology function. And usually, though it's called genetic engineering, engineers play almost zero role in this part. Right? We have cell culture development, purification development, and formulation development. This is the crux of the biotech space. This is the core biotech aspect. The same thing, and then you have supporting this is the analytical development, which is basically the group which develops all the methods which demonstrate what we say we are supposed to be doing. This is replicated if you do a mirror image of this one. Since the cell line is only developed once in the life cycle of a molecule, we don't do anything in operations in this part. You have upstream operations, which is cell culture. You have downstream operations, which is purification. And you have fill finish operations, which is basically taking the product that has been purified and converting it into a dosage form that could be sold in the market. And supporting this, the analytics, the mirror of the analytics is quality control. So this is in a nutshell the entire biotech organization from a core perspective. Okay, so what does cell culture do? Cell culture, the sole purpose of cell culture is to produce the maximum output of products with the major portion of the protein being of the desired characteristics. And the reason you want it to be a major portion is because otherwise you basically are losing a lot of protein, which is going to be discarded, okay, which is of no use to you. So we want it to be something very, very characteristic, okay? And what are the ranges when you do development versus you do manufacturing? In development, you can develop a cell culture, and I'll touch about this one from a 10 ml scale. Today, reactors are down to 10 ml scale, and they can mimic something which is running at a 100,000 liter scale. Okay. Insulin in India has some of the biggest bioreactors. I used to work at Biocon. They had reactors for 50,000 liters. But antibodies in India today are produced at smaller capacities. In the US, Genentech has reactors of 20,000 liters. So even if you're talking of cell culture or microbial cultivation, you've got reactors of fairly variable sizes. Okay? But a very, very standard process, a typical biotech process starts from a single vial of a bank of cells. You scale it up. This is called the seed train. You scale it up across time. And you end up with a production bioreactor. So don't worry about the actual size, but this is the final reactor which produces your drug of interest. And I'll talk about ATF in a little while. So I just wanted to remind you that there are other ways of doing it. And this is the more recent versions where you have a higher cell density. So what you do is a high density working cell bank. The cell bank has more cells to start with. So you end up with higher amounts of protein because there's higher amount of cells in the final reactor. So this is a general upstream process. Okay. In the newer generation, what I was talking about, there's something called the AMBR Amber, which is the advanced microbioreactor. If you take a development lab, say about 10 years back, most of the reactors of 5 to 10 liter scale would be of this kind, where you had pH probes, oxygen probes, impellers, aspargers, everything. Now the same thing can be done at 10 ml scale. In Dr. Reddy's, we have setups for almost 72 reactors in one single platform, about the size of less than the size of a dining table. And each of these 72 reactors can run different conditions. So you don't need to have the same condition running for 72 reactors. The advantage of this is based on a DOE, you can actually develop an entire process with the setup of maybe 2 or 3x of this reactors. Once you do 2-3 times this 72 set, you're done. You pretty much have a process. Okay, but this is a 10 liter scale. And this is what development folks do. But if you go to scale up manufacturing, and if you take the same thing from microbial and mammalian, I just want to contrast a little bit. You take media preparation and sterilization. in a small R&D setup, which is what scientists deal with, you sterilize something and autoclave something. Now you take this to a manufacturing scale, which is 10,000 liters. Autoclaving is not the same. It's not a 20-minute autoclave cycle. And if you overdo it, you burn a lot of nutrients because you're charring a lot of sugars. So how does an engineer step in and demonstrate sterilization at scale? This is an engineering problem that scientists have no clue how to solve. Okay, you do protein expression in an R&D setup. I take a shake flask, I add a little bit of a antibiotic to keep the plasmid. At scale, you cannot have antibiotics because people are allergic to antibiotics. It's not allowed to have antibiotics at scale. In which case, how do you maintain cells without them losing the plasmid? That's the challenge. And then if you do an induction, say you do an IPTG induction, most of you would have heard of the lac operon, but you use the T7 system which has an IPTG trigger. Great. At the scales that we work in science labs, you add a few microliters. In manufacturing scale, which is say 10,000 liters, how are you going to mix the inducer? And the cell densities are so high. In an R&D scale, when you have an optical density of 1 or 1.5, you induce cell culture. In manufacturing, your optical density is in the range of 50 to 100 optical density units, right? Which means what? You've got 100-fold more cells, 1,000-fold more cells. How are you going to be able to add and make sure that the entire reactor is running properly? And how high do you have to have the cell density before it becomes commercially a viable process? This is where the engineering aspect of reactor design, your fluid dynamics that you guys study, control systems, KLA, feed addition, how do you mix the feed? How do you make sure that these things happen in microbial conditions? You switch over to, say, and then the final part, which also want to touch upon is, where is the protein being expressed? Is it intracellular or is it extracellular? Always it is better in microbials to have it intracellular because you produce a lot more protein intracellular. The second you do intracellular, the protein is unfolded, in which case you have to start now refolding the protein. Okay. And if you want to refold the protein, that's an engineering problem. How are you going to do this at scale? Your urea culture, your temperature you're controlling the temperature of refolding. These are engineering questions that scientists quite miserably fail, I will have to say that. You go to a mammalian cell, the same cells which you can use an impeller at 5-liter scale, when you do this at scale with large impellers, these are cell cultures with no cell wall. Your shear forces become so high that you will break the cell. Even a sparger with the oxygenation that you're doing, you know that bubble bursting can cause shear that will kill cells. So how do you control something like this? Media preparation. For microbial, I said you need to sterilize, say autoclaving, you do an autoclave cycle. But mammalian cell cultures, you can't autoclave the media because some of these are very sensitive to temperature, which means you have to do filtration. And just the preparation of the media is actually a gargantuan task, because what happens is to be able to dissolve all the individual amino acids, etc., requires an ability to mix large volumes. And you need to do this in a very quick way because this is done before it is sterilized. Because you can't sterilize raw powders because it won't go through a filter and you'll actually filter out nutrients. Which means that you need to do this while there is a probability that bacteria are growing in your preparation. Okay, and then you need to sterilize it. So these are questions that engineers answer best. You need to keep the culture duration, which is 10 to 15. You keep it viable. You need to feed it enough food, and you need to maintain sterility through the reactor cycle. And what do you do to control the growth? You have oxidation, carbon dioxide levels, ammonia levels, osmotic strength maintenance. Because if you have too high an osmotic strength, your cells will start dehydrating. Even in the presence of water, you will actually start dying. The cells start dying at this stage. Then temperature and pH obviously play a significant role in cell culture. So every one of these is something that at a scientific, at a lab level where scientists work, these are easy to control, easy to manipulate. At reactor levels, you need engineering skills, which currently, incidentally, in India, we don't have enough. Surprisingly, though, we produce the largest number of engineers probably in the world and pretty good chemical engineers, most of them don't think of the practical aspects of controlling it at scale. Okay? And then you end up with something, what I wanted to bring up is an ATF, which basically is, if you take a look at I will come back to ATF here. ATF is basically where you end up with is you try to get the largest amount of cells growing, because if you take a look at how you look at a reactor, okay, and if you take protein expression, you have 10 to 15 days where the cells have been growing. And the protein that you end up with is a combination of a specific productivity, which means the amount of cell produces in a day. You multiply that with the integral of the total viable cells across the culture, and you end up with actually the final yield. It is so you either increase specific productivity or you increase the total number of cells that our reactor sees during the 10 to 15 days that we culture. And knowing cells are very finicky. The ability to push specific productivity is limited, but the ability to increase the viable cells that are present is actually fairly, I would say fairly easy as a concept and very much possible in reality. So what you try to do is you increase the cell density. And how you do this, increasing the cell density, is through this ATF. This is basically a very fancy filtration device, wherein as the culture is growing, you pump out some of the media. The cells also are pumped out, but because of the filter, the cells are pushed back in. The spent media is thrown out, which means you're ending up with rich media is being pumped in, poor spent media is being thrown out. Therefore, the cells grow to a higher density. And if you see that, if in a standard reactor, if you get 0.3 grams per liter per day, you can end up with easily more than an order of magnitude. Actually, this goes a lot more than what is shown here, where tighter values, instead of being about half a gram to a gram to 2 grams today, currently, you can end up with 20 grams of protein per liter per day, which means that your productivity has gone up tenfold. So this is something that is an engineering problem. And the reason I bring this in is the scientific and engineers come together here perfectly, because you need to keep the cells viable. You need to keep the cells growing at a very high density. You need to provide it with nutrients and oxygen, remove all the ammonia. So there's a lot of dynamic aspects that the cell culture is going through. And all of this has to be done from batch to batch to batch over the years. And this is a problem that is probably without even a doubt, I can say that only an engineer can solve. This is not something that somebody like me who is a biologist solves. We don't even think in these dimensions. So this is something that I think that some of you in the future will hopefully address. Okay. And did I just touch upon to say the vaccines are no different at this stage in a cell culture, whether you're talking of different types of vaccine, it's all the same. Now let me switch gears. In the interest of time, I will switch gears and say, how about purification? Okay. Purification, if you take a look at purification, so a very simplistic view of the world of purification is that you have fermentation. Then the fermentation is once upstream, this is upstream, you then have to harvest either the cells or the media. For most cases in cell culture, we talk about harvesting the spent media because that's where the product is. And then you do a depth filtration to get the right kind of binding conditions. You do a couple of chromatography. First, you do a capture chromatography, which purifies the protein to greater than 90%. You're done with 90 to 95% pure product. And the rest is basically just a cleanup step. You do a viral inactivation. Not that viruses are always present, and this is obviously not in the vaccine part. This is the pure biotech product part. You do a viral inactivation, which then goes through an ultrafiltration, diafiltration. Then you do a couple of chromatography steps. The order of these sometimes change a little bit, nothing significant, and finally do a viral filtration. I've told you a viral inactivation or viral filtration. The reason we do this in an industrial setup is because there is a potential. See, remember something, we grow all of these in CHO cells. While CHO is a hamster cell, there are viruses that can infect a hamster that can easily infect humans. So there's a possibility that there is a switch, which is how all your viruses that moves across species come. So here, since we are growing, mammalian cells, we have to be making sure that even though we may not have viruses in our product, there is a potential for viral growth. Therefore, we need to inactivate any adventitious virus that may have fallen into our culture by some fluke or by some error on the part of a person working in manufacturing. We also then do a viral filtration at the end, because this ensures that a lot of these operations that we do in downstream are all open operations. Okay, while reactors and all are closed, downstream operations are usually open. They may not necessarily be open in this traditional sense of open, but there's enough possibility that that there could be a contamination of your product. So we do a viral filtration. After this, everything is a closed operation. And this viral filtration is an absolute filter which ensures that the viral load is reduced. So we claim that each of these steps is able to remove certain amount of viruses. And this is a general process of purification. Okay. At a very headline level, purification is only a subtractive process. You do not add any new properties to the product. You only eliminate stuff. Therefore, if you take upstream yield as being, say, X, downstream is always X minus something. And that minus something becomes critical, because that's where your commercial viability again is impacted. Protein purification has become pretty much a science which is very predictable and easily scalable. But when I talk about easily scalable, I come back to this always. Whenever we talk scale, we talk engineers. Okay. And the scalability part of it, I will come to that in a few minutes. What are the levers we use for separation of proteins? We usually use charge. We use hydrophobicity, we use affinity. Affinity is this one here, which in case of antibodies usually is a protein A chromatography, which is standard. But there are other affinity resins for other products. Then we use size. Where do we use size? All filtrations are size dependent. Okay. Even in ATF, it's a filter depth that you can choose the size of the filter to define whether you want to retain only cells or you want to retain cells plus specific proteins. So that's also basically a size. Differential solubility, we don't do as much. It's more a traditional method. It's not done at scale very much, but sometimes we do it occasionally. And in the final stuff, when we do, if you do crystallization, you do have differential solubility. But and there's always a dilemma between filtration and chromatography. Which one would you put? Where do you put? And why do you do this? And I'll come back to this one in the next slide again. So what are the key aspects that both scientists and engineers have to tackle on this one? One is speed and efficiency are the key. The reason speed and efficiency are the key is speed, because these are open operations. You're talking of media components in this part, but as you go down, you're talking of good buffers, which have salts, and protein, which is basically a good source of carbon and energy, which means bacteria will grow like crazy if you do not quickly go through the process steps. Okay, so speed becomes critical. And from an efficiency perspective, you have to ask the question, why do I need efficiency? Because I'm making a product that has to be viable. Okay, which means that every time you try to remove an impurity, you never have an absolute black and white of impurity removal. You always lose some amount of product. So how much product do you lose? That's the efficiency that you're talking about. And when you do a development, you do what is called as a volumetric filtration rate or flow rate, as opposed to linear flow rate in chromatography. So this switch is something that biologists, scientists are not very comfortable with. It's a very easy calculation, I understand, from an engineer's perspective, but when you're talking of scales of thousands of liters of media or chromatography ready product going through a chromatography column, these things become very critical. The ability to scale chromatography is not a trivial thing, and this is where I think a lot of value addition is done. One of my colleagues currently, who is heading manufacturing, a chemical engineer by training from Plenary, his best contribution both here at Dr. Reddy's and at Biocon, he also worked at Biocon, was on the reverse stress chromatographies, etc., that we do on how do you scale chromatography. So this is something that engineers do really well. Then there is the impact of pressure. When you do filtration, please understand whether you're talking of tangential filtration or you're talking of just a viral filtration, doesn't matter. When you put pressure on proteins, they tend to denature. Okay. So the ability to control that filtration and the speed at which it goes. So you can always have a great transmembrane pressure, you will end up with either tearing the membrane if you put too much pressure, or destroying the product if you're doing if you do the wrong kind of you put the wrong kind of conditions. So this concept of how pressure impacts protein quality is something that's very important. So where we and then, as I was mentioning, all of this you have to do this at scale, and you have to make sure that cells which are not host cells, bacteria, viruses, do not contaminate your product. How do you do this? This is a challenge that industrial scientists face every day, and we have to deal with this with every batch. Again, I will just skim through this slide. Basically, if you take a protein process, I told you this is it. Viral processes are not that different. You have preparation of material, you have culturing the viruses in a vaccine setup. You clarify it, you remove the nucleic acid digestion if it has too much nucleic acids in it. Then you do filtration, you do chromatography, and you finally end up with the product. So in a very generic manner, especially at your with your view of the world, the process that standard biotech drug uses and a vaccine uses are not significantly different. It's all in the details, and you don't need to be concerned at this stage. Okay, so what's the dilemma for a purification scientist and for an engineer talking about this is novelty versus scalability. If you take any chromatography resin, you end up with every year, just like a new iPhone comes up every year, you end up with newer and newer resins that sound great. But are they really useful? Are they scalable? I talk to my scientist colleagues, and they're always excited to get the newest possible resin, which has the best dynamic binding capacity, which is supposed to have the least leachables, etc. But will it scale? Can it handle the pressure? Will the column collapse, etc.? This is something that you need to think about, and engineers win hands down on this part. Then when you're talking of, this is something that I have a gripe about, is we are very dependent on resin-based chromatography. Whereas today's day and age, there is membrane chromatography, which is still not yet reached a level of maturity. But I'm hoping that some of you guys, when you grow up and you graduate, you don't end up being purely engineers, but you actually do research in the engineering fields. And one of the things that you need to do is how do you make membrane chromatography a reality? Because the advantage of membrane chromatography is it's a use and throw. You use a membrane once, you throw it. You end up with no columns to deal with. You don't need to worry about how you pack columns. You don't need to worry about how you clean columns. You don't need to worry about what's the cost of resins, which are ridiculously exorbitant. Membranes are so much easier to deal with, so much cheaper, and therefore it becomes a very scalable process. And obviously, I already mentioned speed and efficiency. So which one do you focus on? Do you focus on speed or do you focus on efficiency? So these are questions the downstream has to ask. And the last bit that I want to talk about from an engineering perspective specifically is formulation. Formulation is basically taking your product, which is a purified product. So now you got your product, say 99.9% pure. And I'll give the 0.1% for different types of impurities. What's the concentration are we talking about? So normally, if you take a rituximab as a drug product, right? I'll just give an example. We concentrate it to about 10 milligrams per ml. And one dose for a patient is either 10 ml or 50 ml. 50 ml is not something that you inject into a patient, you infuse into a patient, right? Which is a intravenous injection. But you talk to a patient, would you want an intravenous injection every time you go to the doctor? The answer is no, even if they're suffering from cancer, and especially when they're suffering from cancers. These patients have already been injected 1 million times. They don't want big injections of IV, running through their capillaries. So you would want something which is easily given, that you go to a subcutaneous injection. But for subcutaneous, you're talking about 1 or 2 ml. That's the maximum you can give, maybe 3 ml injection, right? Which means what? You need to bring down 500 milligrams of rituximab into a ml or 2, which means the concentration of your protein now goes from 10 milligrams to 150 to 250 milligrams per ml. This is the kind of viscosity that your blood currently has, okay? You can just imagine the difficulty of using a syringe to push through this protein without damaging it as you're doing this. And that is where the kind of excipients you use, the kind of approaches you take to stabilize proteins at that high concentration And in the case of, say, something like insulin, where a person gives themselves an injection, you actually crystallize the protein. So crystallization of proteins at scale, just imagine, we struggle to crystallize proteins in small batches in a lab, and you're talking of 1,000 liters of product being crystallized to be delivered to patients. That's an amazing problem that people have actually solved. So doing all of this while keeping the protein's chemical stability, while keeping its biological activity and making sure it does not aggregate is a challenge that I think that requires the best scientific and engineering minds today. And this is where I think that a lot of you youngsters will have to play a role. I will not go through analytical sciences because testing as such is just something that is done after the process. You can never test into quality. Quality comes from the process. Testing is just a means of regulators feeling good about it. So I won't go through this part in the interest of time. And I will tell you just the takeaways. The big challenge from an industrial perspective is scale. Scale is something that scientists do not think about very much. And this is where the language that you guys as engineers have to talk to scientists at early days is scale, scale, scale. I will repeat this a number of times because even being in industry now for 20 years, I still see a struggle between scientists and engineers and how do you bridge this? Then you have the ease of operations, consistency, and efficiency, which is always necessary. From media, just preparing, replenishing media to buffers, to impurity clearances at what cost? Okay, all of this we do. Why do we do this? And I will leave you with the last slide. I don't want to talk because I have barely 15 minutes. Maybe I'll talk a little bit on the other couple of slides. Why do I care about this? Why do we do what we do? Okay, you take something like GCSF. When GCSF was launched by Dr. Reddy's, incidentally, Dr. Reddy's is the first company in the world to launch a generic version of GCSF. The price I bought this medicine for my mother-in-law who was suffering from breast cancer then and who passed away later from breast cancer. It used to cost 5,000 rupees a vial in India, and there were barely about, say, 30,000 vials sold all over India. And this is not even a therapy for the cancer. This is a support for chemotherapy. So this is the support therapy cost 5,000 rupees a vial. And a person needs about 3 injections for every chemotherapy cycle. Okay. We launched this in 2001, and since then the cost has come. Today, the cost of a vial of GCSF is 400 rupees. So you can imagine it's greater than tenfold reduction. And the amount, and this is a 2011 figure, where the size of the market has grown 40% in 2011. Today, it's almost 100 times availability there in the market. 100 times the number of patients can actually get this. It's a 100-fold increase in patient access to this drug. So this is a huge impact in a country like India. And then you're also talking about, say, generic competition of prices. How has it gone all over the world? Has the price drop not just for GCSF happened? Yeah. Actually, if you take the other products that we have launched, and I'll give you just one more example. Rituximab, Dr. Reddy's launched it. When Dr. Reddy's was developing this drug, rituximab, which is incidentally a cure for a certain kind of non-Hodgkin's lymphoma cancer, the cost was 1 lakh rupees per vial. Okay, and a single patient needs anywhere between 6 to 20 doses of rituximab. So you're talking of 6 lakh to 20 lakhs. How many Indians can afford something like this? Dr. Reddy's launched this first at 40,000 rupees. Today, you can buy rituximab in the Indian market for less than 20,000 rupees, which means it's 1/5 the cost. And it's continuously dropping. And some of the challenges that I see for you guys, and I'll put that as the next slide, right? What are the challenges for next generation? You say something like rituximab, which is an average dose of about, we sell 100 milligrams and 500 milligrams. So let's say an average of 250 milligrams across all products. Which translates about $100 almost a vial today, which translates to 21,500 rupees a dose. Okay, this is what we are talking, including packing, transport, and profit is what we are talking of, $100 a vial. But is it sold at $100 a vial? Answer is no. Can Dr. Reddy's make the product at $100 a vial? Answer is no. Actually, just the manufacturing cost today is $100 a vial. And so you end up with patients paying significant amounts. Because Dr. Reddy's is selling different versions of it and different cost of it, we are able to sell drugs at 25,000 a dose, but that's about 100 milligram, not about a 500 milligram dose. So this is an area where we really need to improve to be able to give access to a large population, not just of India, around the world. Dr. Reddy sells his products in almost 20 countries. And we are doing a service, and all of you who are listening in the audience, I hope that someday you work in companies where you make a difference, where the product actually makes a difference. This is an area that is a critical challenge for biotech, where there is no argument whether a scientist is important or an engineer is important, but how do we come together as concerned technical people to solve a problem that countries like India face, where the cost of drugs is ridiculous, and how do you make it available? Okay. While this is one area where I want you to think about, the other challenge is I want, and this is nothing to do with everything that I spoke about, just forgetting everything else I spoke about, look at this paper from Science. This was about CRISPR technology, and they were talking about specifically about CRISPR, but this is a microcosm of everything that Indian science stands for, and I have a big gripe about Indian science. So these are the number of papers that were published about CRISPR in the year 2018, and you can see from the US and China, you have about 800 papers. India, you have 50 papers. Okay, so this is the total number of publications coming up. The same one, actually the figure is here, I transposed the figure here, is the number of patents that are patents, whichever pronunciation you prefer, patents or patents, which comes out of from each country, which actually means that is our publication worth its salt in an actual application. You see this, these are the application-based patents. And sadly, there's not a single Indian patent which has seen the market. Okay. This, for me, reflects the kind of science we do in India, and I'm taking personal responsibility also of the same quality of work that we are doing, is we do not have a patent in critical areas where other countries are able to pull off. So where are we? We are still fighting amongst ourselves as opposed to fighting the actual battle, which is how do we make drugs available, affordable, and help the general population. So I will leave it at this. I will not go into the long term because I said I will close at 12:20 and it is 12:20. So at this stage, I will stop the presentation. Figure out how to stop the presentation. Okay, and let me get back to stop sharing. Yeah, I guess stop sharing does it. Yeah, thank you. So I will be more than happy to take questions. I said I'll finish at 12:20 and I'm done.
Thank you, sir, and thank you for keeping it as much as possible into the engineering side. I'm glad. Sir, there are a few questions on YouTube channel. There are two based on the manufacturing and the reactions. The question is, what is the scope of using a continuous flow reactor to manufacture vaccines in bulk? And how is the temperature supply maintained evenly throughout the reactor?
What is the second part? How is the temperature maintained?
Evenly throughout the reactor.
Okay. Yeah. So the first question was on?
What is the scope of using
continuous reactor? Yeah. So see, you can use continuous, or we call perfusion reactors for vaccines and biotech. There's no such thing as you can't. The big problem in an industrial setup usually is that how do you define a batch? In a continuous reactor setup or perfusion setup, every day or every specific time-based interval, you harvest a reactor's material and it continues to grow. So you're skimming off from the top a certain amount of material, and that you then you try to purify it. Unluckily, that will mean a separate batch. And in a vaccine setup, when you're talking of viruses, that's not very easy to handle. Vaccine purification setups. Dr. Reddy doesn't produce vaccines incidentally, because the infrastructure needed is very complex. The controls that you have, because these are viruses that technically can kill a person, and before they're inactivated, it's actually a biohazard. So they usually prefer a batch production, and continuous is not something that is done very much. And it is actually a very difficult thing to do from a vaccine. Even in the biotech space, there are very, very few. I think influenza was the only one that comes to mind, which is the continuous process. So no, continuous processes are not something that are encouraged or commercially very easy to manage. And then on the temperature, how do you maintain at scale? Your impeller is basically mixing so these are jacketed vessels. The jacket is where the temperature is being maintained using water, chilled water and hot water combination. And the impellers have to not only mix the feed, the bubbles of aeration, they also make sure that the temperature is maintained. So it's purely reactor design, reactor on how the jacket works.
Thank you, sir. Sir, there are quite a few questions on vaccines.
Yeah, please go ahead.
Yes, sir. What is the difference between antibacterial and antiviral vaccines like typhoid and influenza vaccines?
So let's say an antiviral vaccine is there. In an antiviral vaccine, like I had mentioned, you can either have a virus, and this is true of antibacterial also to a certain extent, but more bacteria is slightly different. I'll come to that. So when you talk about viral vaccine, you can have a virus and inactivate it. So what you do in a virus to inactivate it is you literally grow up the virus, which is a live virus, and then you add certain chemicals which cross-link the DNA. And they do a fairly significant amount of cross-linking, which what it does is the outer shell of which is the protein part, which is actually your antigen, remains intact, whereas your ability to replicate, which is what your infection is all about, is killed. It's completely killed, and you have to kill it. So it's done multiple orders of magnitude of kill, such that you end up with, so basically you end up with a viral particle which expresses certain protein on the surface, which then stimulates your immune system. So that's a viral vaccine, right? In a bacterial vaccine, are you different? No, the answer is very similar. You use a bacteria, which you use capsids. So bacteria have proteins on top of it, but they also have a lot of sugars like capsids, capsules that are there. So you need to make sure that that's not there. And then the bacterial vaccines can be produced either as a specific protein, because bacteria, the disadvantage is a lot of the bacteria have spores and they're not very easy to kill. So it's easier to produce, say, a protein of the cell surface. And in bacteria, you have to be careful because viruses, almost all the proteins are cell surface expressed. Bacteria, 95% of proteins are intercellular. So they have no vaccine power in them or immunogenic power in them. They will be immunogenic, but they don't provide you any benefit. So it has to be a surface expressed protein. So even in the case of bacterial vaccines, you do tend to produce certain inactivated bacteria, but you would not normally worry about so much of bacteria. The vaccines are usually given for viruses because the biggest advantage you have is you have antibiotics, which viruses just don't, since they are not life forms in the traditional view of life form, you only focus on antibiotics for bacteria. And that's the reason why bacterial infections are usually treated with antibiotics and not so much with vaccines.
Yes, sir. The next question is, how do vaccines work in the body in creating immunity? And what is the chance of the vaccine itself being the cause of a disease?
Okay, good. I see that the vaccine, because of COVID, everybody has questions on the vaccine. That's perfectly fine. So the way the way the vaccine triggers your immunity, there are multiple ways they trigger immunity. But to be keeping it simple, for an immunity, you need an antigen, right? Vaccines, when they get ingested into your, when you get a vaccine dose, your immune cells pick up the vaccine, whether it is a viral particle or whether it is a spike protein, like in the case of SARS. The protein is ingested into T cells, specific T cells, which then express the fragments of these proteins on their surface in the context of, so if you take an antibody, you know the antibody has the famous Y shape, right? Just like the antibodies, there are certain proteins that are expressed on the surface of T cells, okay? These are the HLA proteins, and they also have a capacity to take the digested virus, and in the presence of these cell surface proteins, they put this protein in that context. And then there are specific B cells, which actually are the antibody producing cells. So B cells, they are two types. One is which is I would always call it as a totipotent B cell. I would say it's actually a pre-B cell, which basically what it does is it sees this antigen that is being expressed on the T cell and says, I might be able to bind it. And it's a statistical event that happens, which random binding happens. And when there is one type of B cell which finds its match against that particular antigen, it stimulates that B cell to now undergo certain kind of maturation, which then produces proteins of very similar nature, such that it then begins to bind that particular antigen. That stimulates the B cell cascade, okay? And that cascade basically now produces a significant amount of B cells, which have different population of types of B cells, which all produce antibodies against this particular antigen. Some of these are very potent antibodies, some of them are not potent, and the body has a way of modulating this such that you end up with a very mature B cell, which has a potency that is sufficient to trigger an ability of that particular antibody to bind the antigen, which now you may see when you have an infection. So what you basically, in a very simplistic way, is you inject a particular vaccine. T cells help the B cells to recognize this as being foreign, and then these T cells, then these B cells produce antibodies against that, and that is your immune system. From an antibody based, there's also a T cell based immunity, and I don't want to go into that one because it's kind of more complicated.
Yes, sir. Another question is, vaccines are generally a dormant form of living virus. So while the manufacturing process, does it mean that the virus is living and then we try to kill them before injecting into the body?
Yes. And certainly not all viruses, especially in today's day and age, you guys should know that RNA-based viruses are there, which is not a viral-based vaccine. But your question is true that any virus, which is a live virus-based vaccine, they actually grow it up. They grow it up in different cells. HEK293 is a very commonly used one for adenoviral-based vaccines. But you have to grow the virus. Therefore, there are special reactors, special conditions. I don't have the expertise, even basics of how they do it. But yeah, they are grown up in large quantities. The virus is purified and inactivated. That's why I said the inactivation of the virus is the critical one, because it can lead to a disease if you do not. But the safety measures are so high that I don't think it's very common. I think it's 1 in a million or 1 in a billion that a person, I wouldn't even say 1 in a million, I think 1 in many, many millions that it could ever be a disease causing agent.
Yes, the next question is on the shelf life of a vaccine.
Yeah.
Can it be used after its expiry date?
No, I would not. I would not recommend using it after expiry. See, so when we talk of expiry date for protein-based products, it's not like the day after the expiry there is zero potency. Never. It never happens. So even the worst of the drugs that we sell, we have a shelf life of 2 years. At that stage, it is still 80% potent. And I presume vaccines are of similar nature. They are probably 80% potent. Do you want to take a chance? My answer is no. Even though I know that it is probably going to be fine, because even when I say a 2-year shelf life, I have tested the stability for almost 3 years. And I know that even at the end of 3 years, there's 80% potency. I don't know how people store stuff. The problem is not when we manufacture it and store it in ideal conditions in the lab. What happens in the market? What happens in have you ever been to a medical store? Half the people keep the refrigerator turned off. in Indian temperatures, is it recommended to do that? No. So I would never recommend using a drug after its shelf life.
So we have time for one last question.
Sure.
Why is there a fall in price of the vaccine after the entry of generic drugs? What is the difference between a generic and non-generic category of drugs?
What's the difference? What's the difference is that a generic drug is manufactured by somebody else who is copying the innovator's process. We are a generics company. I made my career in Dr. Reddy's being able to produce generic versions of antibodies. Is the quality of the drug any different? I would any day use the drugs that I produce for my family, for myself. I would use it because I know the quality. And don't go blindly that the innovator has got such high quality that they're the only ones who can be trusted. No. We have as much scientific knowledge and as much controls as the innovator. Has no generic company cut corners? That I would be lying if I said that. Ranbaxy is a classic case. So do you trust? That is where the names of a company comes into play. Dr. Reddy's, and I feel good about working for Dr. Reddy's, has a very high efficient quality consciousness. So my bosses, all of the people, they tell us only one thing. There's a hierarchy that we have. Safety is number one. Safety of individuals working in the company. Okay. Safety is number one. Quality is number two. Productivity is number three. And yield or everything else is last. So safety and quality are the number one and two always for any manufacturing. We are very clear about it. I have rejected so many things because we have had suspicions that there may be something wrong. So do generic companies have quality? Please come over to Dr. Reddy someday. Come over and judge for yourself what's the quality of the product we manufacture. And we will be more than happy to entertain students from Indian institutes to come over, not just IIT Madras, but from any Indian institute. We have welcomed students from all over India to come take a look at it.
Thank you, sir. So this is the end of our Q&A session. And thank you for sparing your invaluable time for joining us and giving this wonderful lecture.
My pleasure.
Thank you, sir. We hope to stay in touch and maybe invite you for our future events as well.
If I made a difference, I'll be more than happy to come back.
Thanking you again, sir. Thank you.
Thank you. Thank you very much.
Thank you, sir. We have our next plenary lecture at 5 p.m. today, and it will be delivered by Professor Ravi on the next generation of PSC and sustainability. I request the participants of various events to join directly to their activities. Thank you.